Hello. We have a few minutes in which I can help bring you a better understanding of COVID. My name is Dr. Stephen Mark Hayden. But what makes me unique is not because I'm a medical doctor. What makes each of us unique is that each of us have a unique destiny to follow the things that are purposeful in our life. Let's start out thanking God for all our blessings and asking God to give us a blessing so that what you learn today won't be used to harm others, but to help others. And that you'll have more peace of mind when you finish this than when you started. Let's say a prayer. Our Father, who art in heaven, hallowed be thy name. Thy kingdom come. Thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our debts as we forgive our debtors. And lead us not into temptation, but deliver us from the evil one. For thine is the kingdom, and the power, and the glory, forever and ever. Amen. God has a purpose for all of us. He wants us to love our spouse. We marry for better or worse till death do us part. Sometimes our family members will get the SARS virus in their mouth. Sometimes they will get COVID. We don't want to abandon them. We want to stay with either our parents, our wives, or our children if they get sick. Let's learn as much as we can about COVID. So why, if you're learning, how can we learn from COVID tonight? Tonight, when you're watching this later, you'll get to see me swallow some SARS-CoV-2 virus. I won't die from it. I probably won't even get sick. I've done it before, several times. I've been around people that exhale COVID that are PCR positive and rapid strep and the rapid COVID positives. I have to thank God that I'm still alive today. But part of me has to thank God for the wonderful body and the wonderful immune system that God gave you and God gave me. You see, viruses have been around since Adam and Eve. Viruses are in every room, unless it's ultra-sterile clean room. And viruses are something that we can live with. I can live with SARS-CoV-2 inside of me. I've even grown it in my intestinal tract. I grew it because I swallowed it. Is this for you? No. You need to follow whatever advice your physician gives you. Now, is your physician able to make decisions about himself? Well, if he's a licensed professional, licensed to practice medicine in his state, he can consult an attorney and do whatever he feels is right. Now, is it a crime for me to swallow SARS-CoV-2? I don't think it's a crime. I have not seen any laws. There's no laws published that say I can't swallow SARS-CoV-2. Now, if I was going to harm myself, do deliberate harm that was obvious harm, let's say I was going to cut my finger off, that should be stopped. Because you know that if I cut my finger off, I can't use my finger anymore and I'm going to need to grab things. And that's self-harm. But how much do you know about the effects of swallowing the COVID virus, SARS-CoV-2? You don't, because you've never seen anybody do it. And you don't understand the risk and the benefits. So let's talk about risk and benefits of swallowing SARS-CoV-2. Well, if you go to my website, antivirusair.com, you'll notice that people only get severe COVID disease when the COVID virus reaches their alveolus. If the COVID virus is isolated just to my small intestine, there's no proof or no evidence that that by itself causes disease. Nor is there any evidence that in ordinary people that are outpatients that have been exposed before, that the SARS virus will migrate from the bloodstream into the alveolus. Quite the opposite. SARS-CoV-2 that gets in the alveolus eventually makes it into the mouth and throat and gets swallowed and goes down to the intestine. But eventually, after 3 or 4 days or 5 days, the intestines will likely begin to process that virus in the small intestines. It is my impression of things, and I'm not trying to oversimplify things, but I want this to be something that can be readily grasped. My intestines provide my immunity that defends the rest of my body. Right now, look at me. Are there bacteria in my body and viruses? There are viruses definitely in my colon. There's bacteria in my colon. There's all kind of, but my small intestines are managing all kind of natural flora and managing it very effectively. My intestines are an essential part of my immune system. When I introduce a virus to my intestines, that gives them, my intestines, the opportunity to process it and make a better antigen. We live in a complicated world. That's true. But God has given us an immune system so that we can eat food that has viruses on it. Think of the time when we walk through a field and eat an apple. Is that apple free of viruses? Probably not. Viruses are all around us. Now, what about saliva? Is saliva itself poisonous? No, it's not. I kiss my wife. She has saliva. And sometime my wife will eat a piece of food and she'll give it to me. Am I afraid because her saliva is on the piece of food she just offered me? No. Her saliva doesn't scare me. Now, should you be cautious with the saliva of other people? Yes, you should. You should be cautious because they could have herpes. You don't want to get herpes. It causes mouth sores. And even if you're an old person, you can get mouth sores that are painful. They're like cold sores. They're uncomfortable. You also don't want to get, well, most people get cytomegalovirus, kissing disease. There's a number of other theoretical diseases that potentially could spread disease, like mononucleosis. You know, that was called the kissing disease. But when I collected this saliva, it was from donors. They knew what they were donating it for. They were friends, and they donated it to a worthy cause. And they didn't have mono. They didn't have the big swollen nodes. They were healthy people who just had the SARS-CoV-2 virus. They didn't show any signs of hepatitis, mononucleosis, or strep, or other bacterial infections. Now, what can I do to reduce my risk when I swallow this saliva that contains the virus? I can say that despite my best efforts, some herpes virus might have made it through. I can take a cyclovir for the herpes family group to try to reduce my risk of getting any type of cold virus or herpes virus from the saliva. And I've done that to try to reduce my risk because I want to be as safe as possible. Now, what are the benefits of me swallowing this SARS-CoV-2 virus? Well, as I told you, this ain't my first time. I've done it numerous times. This is probably 4th, 5th, maybe 6. Now, the other times I swallowed it, did I get real sick? Nope. Did I vomit? Nope. Did I have diarrhea? No. So what are the benefits? Well, I want you to look at the immune response to SARS-CoV-2 differently. If you're watching this program, I want you to appreciate the beautiful complexity of the human immune system. Realize that it's not the COVID infection of my small bowel that is a danger. It's only the COVID infection of my lung that pre-exists for a few days before an intestinal infection occurs that is really a threat. You've heard about all those people wind up on respirators in ICU, and I've seen people that get tired for days and weeks from COVID. That means that they had a significant autoimmune reaction, and they are tired for days or weeks afterwards. I don't like being tired. I like having energy. I'm sure you like being healthy too. So I'm familiar what happens when things go wrong. This is not something I'm going to put off on my insurance company. In fact, I don't have health insurance. Now, if I had a nice government job or something like that, I'd gladly take insurance. But insurance companies are not going to pay for my illness. Not Medicare, not Medicaid, and not Blue Cross Blue Shield, which actually has outstanding health policies. I highly recommend them among the private insurers. But it's not about private insurance. This is about learning about SARS. So let's go ahead and get on with it. Let's discuss now what can you get out of this? Well, there's at least 7 million positive tests in the United States that have had SARS virus in their mouth. And that was determined by rapid tests and PCRs. But there's many millions of others who actually had it and didn't get tested, and it cleared up before they got tested. There are a lot of asymptomatic people, and we don't know how many millions of asymptomatic people there really are. There may be tens and tens and tens of millions of people who are asymptomatic, who had it and on their food, and they swallowed it accidentally and developed some type of immune experience that taught their body how to defend against that virus. God made your immune system as a wonderful, wonderful system that is designed to protect you so that you can have the life expectancy that God wants you to have. I don't think God wants us to live in fear. We need to lead a life that glorifies God. God wants us to be able to take care of our wife, our children. He wants us to be able to go and worship in a church. And yes, sooner or later, I will die. All people die. But life is not about avoiding death. Life is about making the most of every day to achieve our purpose in life. We can only thank God for our health. My health is not the product of Medicare. It's not the product of Medicaid. I don't owe my health and my life to the federal government. I can thank God that God has a plan for me. And the reason I'm alive today is that that's what God provided for me. My life needs to glorify God, not the pharmaceutical companies. Now, does that mean that pharmaceutical companies and vaccine companies don't make some wonderful products? Yes, they do. And if you're a vaccine company and you're watching this, what I would like you to take away from it is to think about using the GI tract to achieve immunity. Because if you follow some of the vaccine experiments, some of them have been stopped because they're serious side effects. Now, if you look at SARS-CoV, most of the young people have a very low rate of death. The rate of death for those less than 19 or 20 is like 3 or 4 in 10,000. The rate of death for those less than 50 is still probably less than 1 in 1,000. Once people get 60 and 70 years old, that rate of death goes up. And eventually, the rate of death, the average age of death winds up being almost in the 80s. It's not young people that are dying, even though some in the media might like you to think that. There are exceptions. When a young person dies, it's often from an immune disease, HIV, leukemia, something like that. Normal, healthy young people don't die from AIDS except very, very rarely. Now, before I engaged in any experimentation, I calculated my risk of death. And when I took my first inoculation, here's what I knew. I knew that if I accidentally contacted SARS-CoV-2 by swallowing it, by accident, my death rate would be less, I calculated, than 1%. Well, what is 1%? I am about 58 years old. I am 58. Let's say I have a healthy life expectancy of 70. I may live longer than that. But let's just say I live to 70. That's 12 years. A ballpark number would say I have 4,000 days until I'm 70 years old. 1% of my life expectancy would be 40 days. So even if I had a 1% chance of death, I would lose about 40 days off my life expectancy. The reality is, though, there's probably 2 to 3 times that, or 4 or 5 times that, asymptomatic for every symptomatic case. And as long as I don't get it into my lungs, there's almost no way, and I knew that there's almost no way in which I would die. So I'm really not very brave, and I'm certainly not reckless, because I calculated out the risk very precisely. There was a risk that I could get sick, and I sure don't want to go to the hospital. That is very expensive. And I didn't have insurance. That means they would expect me to foreclose on whatever assets I have, and that wouldn't be very nice. I don't want you to ever do anything reckless. But if there's something that needs to be done, you shouldn't run from it either. And what needed to be done is to show that the GI tract is the best way to receive SARS-CoV, the COVID virus. And maybe that's what me swallowing COVID 5 or 6 times did. I hope so. And I hope that what you need to take away from this is not that inoculation is right for you. Because you should never follow any medical advice except what your physician, who's authorized by your state medical board, approves for you. Now, if you're a physician and you have to see patients, you might think about inoculation for yourself. That's different, because you can study these issues for yourself, and you as a physician can decide what's right for you. You're not like John Q. Public. In fact, you're licensed to practice medicine. And you as a physician are required to be around patients that are going to have COVID. I know from being a doctor that it makes you very uncomfortable when you don't know whether the patient is exhaling deadly virus. If every patient encounter is an encounter with potential death, that kind of messes up the doctor-patient relationship. So, am I thankful? Is it a blessing for me to be immune? Yes. How do I know that I'm immune? I've told you that I swallowed it on numerous occasions. I know that I'm immune because I grew it. I had the PCR antigen test in my stool. There is a wonderful laboratory approved by the government that confirmed that I had the virus growing in my stool. And I want to thank that lab for running that test to prove that the PCR test was positive on my stool. Because had they not done that, I could never have been certain that I achieved an inoculation. I want you to also take a moment to think about centuries ago when there was smallpox and the death rate was 25%. At least that's what I was told. The death rate from COVID is less than 1%, perhaps 0.0, maybe 0.2%. It really depends on the age group. But imagine if there was a mutation. What if there was a virus out there, a new virus, that applied to both the GI tract and the respiratory tract? What if it had a mortality rate of 25%? Would I want to sit around sitting on my hands, waiting for the government to come up with a way to protect me? Or would I want my own immune system to protect me? You see, my stool COVID test showed that I had achieved immunity on or about early part of July 3rd. I didn't have to wait for a vaccine, and that was God's blessing. Now, does it mean that if the vaccine companies came up with something that was safe and well tolerated and was effective according to the CDC rules, I would certainly encourage my family to take it. But they haven't been able to do that yet. What if there's a mutation so that something far worse came out? It's just an alternative. I have practiced almost 30 years. In fact, I first got actually 32 years. Time flies. I believe in alternative care. I believe in natural processes that help the body's immune system and the body's to do well. And if you've ever been in my kitchen, you'll know I take a lot of vitamins because I believe in nutrition and healthy response. I even don't eat pork. I haven't eaten pork in a long time. I avoid pork because I don't think it's real healthy. I avoid a lot of animal fats. I don't smoke cigarettes. Okay, look at cigarettes. If I wanted to smoke cigarettes, even though I'm a doctor, I could go down and smoke a cigarette. Don't smoke cigarettes, but I could. You shouldn't either. They're bad for your body. But I'm allowed legally to go smoke cigarettes, even though they're bad for me. I won't do that because that's unhealthy. I buckle my seatbelt. I pay my taxes. I try to be a good citizen. I try not to take excessive risk. You should not do this because you've never seen anybody do inoculation. You have heard of a bunch of drunk college kids getting together at parties, coughing and breathing in each other's face. That is some of the most dangerous ways to transmit COVID virus there is. When you cough in somebody's face, it may reach their alveolus. I wouldn't have somebody do that to me until I was sure I was immune. And the only way I could be sure I was immune was to actually have the stool culture. Never, never, never cough in somebody's face, breathe in somebody's face while you are shedding virus. That's a real big no-no. That is. And I would never, never do it. And if I wasn't immune, that would make me very afraid if someone was doing that to me. Now, am I afraid of other viruses? I don't want strep throat. I don't want influenza. I've had flu before. It's very uncomfortable. Do I take flu vaccines? For years and decades, I have taken flu vaccines that are approved by the CDC, and this is October the 13th. Take your flu vaccine that is approved by the CDC. That's reasonable. It's safe, it's well tolerated, it's known to be effective in many times it is effective. So, I don't want you to be reckless. I don't want you to take chances. I don't want you to take this information out of context. An expert can do things, and anytime you handle any type of live virus, it's not a joke. It's not. It's dangerous. You got to know what you do. It is not something to be done by accident or recklessly. It must be done only by people who understand the risks and benefits. Talk to your physician. So, I told you you would see me swallow SARS, and in just a minute, we will. Why don't we go ahead and hit pause, and then we'll make our capsules up, okay?